Okay, mental health disorders around the world. We are going to talk about Japan and Germany and the success they have had. It was hard to find the world's greatest mental health organization in the nation because they're all kind of sliding across. None of them very good, but some better than others. Okay, but it's hard to tell. We're also going to talk about teen issues and all that stuff later on in the video. Later in the next segment. Residents of treatment facilities of severe mental disorders in primary care. Notice that America is top. Presence of 3 essential therapeutic psychotropic drugs at primary care level, meaning treated with psychotropic drugs. America is at top. Presence of mental health care and of community care, 71%. We are nearly at top. The only country that beats us is Europe. So why are we so depressed? The next video will go into this, and this was done by mental health care, the primary care level, and the community and countries of WHO regions. WHO is a very good site to get information from. Very accurate, very well done. Notice that Southeast Asia has 44.4%. So there are some places that are suffering, but notice that it has 88.9% when it comes to psychotropic drugs. So it's like we're all off balance. We don't feel a scale anywhere. And German healthcare system has the reputation of being one of the best in the world. There's an extensive network of hospitals and doctors covering even the most remote areas of Germany. Germany has a mandatory statutory health insurance (SHI) for employees. Public health is mainly within the jurisdiction of the federal states. The federal states are also responsible for planning inpatient facilities and financing investment in hospitals. In 2006, total healthcare expenditures were $245 billion. There are 4.3 million people working in the healthcare sector, amounting to 10.6% of the total workforce. Of those of the healthcare, 50% are salaried employees employed in inpatient care. There are 3.5 practicing physicians per 1,000 residents. In Netherlands, there's 3.8. Norway, there's 3.7. Sweden 3.5, UK 2.5, US 2.4. So Norway, Sweden, Netherlands are all good. And 9.8 nurses per 1,000. Netherlands 8.6. Norway not 31.5. Sweden 10.7. Like I said, Norway and Sweden are doing great. US 10.5. In general, there is a universal coverage for mental health care services throughout. Restrictions may apply for certain services. So what's going on is Germany is building an infrastructure that helps mentally ill people. We're not saying that they don't have mentally ill people. Of course, every country has mentally ill people, but it's taking care of them that counts, and they are taking care of them. From what I've read, from what I've studied, from what I've learned, I say that Germany is taking care of them. Do I think that they're the best country? Not necessarily, but I think they're one of the best. I named some other ones, Norway and Sweden. And so I think they're doing a remarkable job. Germany has always been top in lots of things. They are expanding at an alarming rate. Not an alarming, but an extensive rate. Germany is a good country, and it's doing very well. It's doing extremely well. But 10.6 of the total workforce, that's huge. That's monumental. They're giving they're planning hospitals in the most remote places. So they're trying hard to help the mentally ill, because they know that the mentally ill need help, and to get them back on the feet means more employees, more workforce, more people out in the world doing good, more extensive work. So yeah, of course they're going to do that. They're smart. They know that mental illness needs billing, meaning needs money, because without it, what are we going to do? I mean, are we just going to let half the population just sit in mental wards? No. We fix that, and they get back on their feet, and they work. That's what happens. So that's just baloney. just baloney. But Germany is just phenomenally doing well, from all studies I've seen. Oops, paused it. I read a study that said Germany was actually number one, but studies vary from study to study. Like you're gonna see in a few seconds. Well, like you did see, it showed America as the top ranking in infrastructure for mental illness. But is that necessarily true? That you can have all the psychiatrists in the world. That doesn't mean that we're gonna get better. What we need is more hospital beds in America. We need more therapeutic hospitals. We need more money spent in the infrastructure of the hospitals. We need to get people back on their feet, working again, and being beneficial to the economy. You know what I mean? So, yeah, that's what Germany's doing. And Germany is smart. Germany's always been smart. But, as far as we go, we're going downhill. And you'll see that in a second. But I'm thinking about doing a video on Norway and Sweden because they're also amazingly sophisticated. And they're both very liberal. They have liberal drug laws, and yet they have low percentages of drug abusers. So it's just kind of weird, you know what I mean? It's very surprising. The United States is a nation in severe decline, and it is beginning to show up in our mental health, which is in the reflection of the troubled political and economic times we find ourselves in. This is a segue to the next video. Next video explains why America is so messed up. And you'd be surprised what you see. You'll be very surprised. It's not as simple as it sounds. They hate us because of our freedoms. Who will ever forget this previous statement by one of the intellectual giants of our times, George W. Bush? Was George correct about the freedoms America possesses, which would cause someone to do us harm out of envy? Like I said, we will get to that in our next video, which focuses on that. On the surface, America appears to have much to be thankful for, regard to degree of freedom and to amount of opportunities available to us. We just seem to be the happiest people on the face of the earth. However, the data tells us much different story. Truth. In 2013, over 9.3 Americans had serious thoughts of suicide during that year. During that same year, 43.8 million adults age 18 or year older, this is more updated data, experienced a diagnosable mental illness as 2.7 million, 1.1% of the population made suicide plans, and 1.3% of the million, 0.6, attempted suicide. That's just unacceptable. 1.3 million people attempting suicide? No. The report by the Substance Abuse and Mental Health Service Administration, MHSA, also finds that 10 million adults experienced a serious mental illness and 15.7 million adults experienced a major depressive episode in 2013. 15.7 million. These results continued to the same trend found in 2012. When the findings reached the astronomical levels, the report of the Substance Abuse and Mental Health Service Administration also finds that 10 million adults experienced a serious mental illness and 15.7 million adults experienced a major depressive episode in 2013. The results continued to the same trend as was found in 2012. When the findings reached the astronomical levels, the report by the Substance Abuse and Mental Health Service Administration also finds that 10 million adults experienced a serious mental illness and 15.7 million adults experienced a major depressive episode in 2013. These results continue the same trend as was found in the years 2012, when the findings reached astronomical level. So, and they're talking about depressive episodes. This is not talking about just all mental illnesses. 50.7 million adults experienced a major depressive episode. That's pretty high. I gotta admit, it's alarmingly high.